I have a question from one of my patients. Can I be allergic to dental implants? Well, let me tell you that, first of all, we need to understand that this is the first moment in human being where you can have something external going inside your body that is going to live there and your body is going to accept it. This is a very interesting thing because we're used to have solutions just like that, and we need to remember that medicine, it's something that is not precise. It can have differences depending on each patient. If you're a patient that you're healthy, depending on your age, what are your habits? If you have problems with drugs, alcohol, or any type of systemic disease, that's going to affect on the body response. Technically, implants don't fail. You have a bone rejection. So when they tell us that, am I going to be allergic to a dental implant? Just remember that the metal that is more compatible with the human body is technically titanium. It's almost pure. It's titanium that is going to be osseointegrated, that's the word. But technically it's going to be an osseo adaptation to the body because the body is going to allow that metal to live there. It's the same material in implant dentistry that we use on implants that what you can use on a hip replacement, just for instance. And also, the only way to know, because there are some studies that they can tell you about, we can do some lab tests and all that, but at the end is that each patient is so different. I had a patient that told me, I'm allergic to dental implants, but at the end he was so desperate because he couldn't use those dentures that I told him, well, let me try. What could be our worst scenario? That I put it in, he was gonna be here for 7 days. So I told him, come the day one, here I'm gonna place one implant. Don't worry, I'll be monitoring you. Let me put that implant. If you're gonna be allergic to, what's gonna happen? All that area is gonna be having rash and it's gonna be something like an inflammatory process. But at the end, nothing happened. So it was something that they told him on the lab that he must be or could be allergic to this type of metal, and what we had, it was a different response. So depends on lots of things. Now, only 0.0001% of human population is allergic to this type of metal. So if that's your case, well, you're not a candidate for dental implants. But to be honest, mostly all the patients, they can place dental implants. So if you're thinking that you're allergic to, let's check out your story. And you can send us more information and we can certainly find out a solution. And if at the end you're allergic to dental implants, there are other ways to work with that out. So I hope that you have a response for this question that you have, and thank you for watching.